Savvy Central Radio, drawing out the best from our guests, with host Christina Nichman.
Our sponsor today is Family Kind. Family Kind offers education and support services to adults and children experiencing separation or divorce. Family Kind teams up with mental health experts, lawyers, mediators, and parent coordinators who are licensed professionals with decades of experience. To find out more about Family Kind, visit familykind.org. Today's episode is in honor of Autism Awareness Month, and our guest is Penina Rybak. She is the founder and CEO of Socially Speaking LLC. She is an educational technology consultant and an autism specialist. She has practiced for over 2 decades and has provided treatment to young children with autism, special needs, in home-based early intervention, center-based preschool intervention, self-contained school-age classrooms, and private practice. Stay tuned for Penina's new book, Autism in the iEra. To find out more about Penina and her work, go to sociallyspeakingllc.com. Hi, Penina. Welcome to Savvy Central Radio. How are you?
Good. Thank you so much for having me.
Well, you're welcome. I'm glad to have you out talking about a subject that is very near and dear to me. I think we spoke prior to the interview that in my early 20s, I had one of the most awesome experiences of my life working for about 1.5 years working with children with autism. And you've been working in the world of speech pathology education and working with children with autism. What brought you to this whole niche and working in this area?
Well, the truth is I had 2 childhood friends who had siblings with special needs. One of them had autism, and it just really interested me. Also, my mother is a psychologist who at different points in her life specialized in children with special needs. So I used to go to work with her, and I was fascinated by, I called it kind of like the saran wrap between, me and other neurotypical children and the kids with autism and special needs who are kind of with us, in the neighborhood on the swings and outside on, the lawns, but, not really participating. And I had a chance to be a camp counselor right before college with special needs kids, and it kind of made me realize that this is what I wanted to do. So I started off as a special education teacher, and the Board of Education of New York at that time was looking for people like me who they could promise, we will pay for your master's in speech therapy, because we have a shortage of speech therapists in New York State. This was in the early 90s, but then we kind of own you, and we're going to send you to different districts. But you'll be able to have a teaching degree, you'll be able to have a speech pathology degree. And I kind of like that because I knew that I wanted to work with kids with autism. I knew I wanted to become a speech therapist. And I have to say that I was working with children with autism way before it was cool, way before it became the in thing to do. And it was really, really important for me that a lot of these kids work on having social skills and having play skills and being more part of the conversation at the table and more part of their community. And I guess you could say, that my childhood and my parents kind of shaped my career path and my career decisions.
When I worked back with that group, really, it was interesting that they always talked about children with autism and the support services, but they never dealt with, okay, what happens when these individuals become adults? It was never even mentioned or brought up in society. And these are real people who, you want to grow up and be part of society and serve society in the best way they can with their skills and talents. And it was sad that it really was not given any attention, at least in the 90s.
Well, the truth is that was a decade of transition for special education, because years before, a lot of these kids had health issues like seizures, and they would get sick easily, and we didn't understand a lot of the brain neuroscience, the neurology. We didn't understand a lot of the science that we do today, because the technology revolution really started in the late 80s. So before that, we didn't have a lot of medical data. We didn't understand certain things. So a lot of these children with special needs and autism honestly would have shorter lifespans. They would get sicker faster, and it would linger. A lot of these children were not getting the early intervention that started in the 90s, where we really started seeing a shift in the United States, especially for children to start getting diagnosed and getting services when they were babies. That was kind of unheard of, in the 60s and in the 70s. So these kids would end up in group homes and, they'd go through the school system, but then they wouldn't really get what we have now built in place: vocational training, vocational rehabilitation, vocational consultations. And again, a lot of these kids, were battling, all sorts of medical conditions in addition to whatever else they had in terms of autism and special needs. So when YAI first started working with kids, it was really amazing because they were trying to create a system-wide program, for a system that wasn't really in place yet. Mm-hmm. So there were pioneers like YAI and like other school districts and organizations out there that were trying, but we didn't have anything that was a real unified approach until IDEA, the law from the federal government about special education called the IDEA, was revised in 2004. And after that, we started to see a huge shift in how we were treating kids with autism and special education, until age 21, when we were giving them services in the school system. And then what happened to them afterwards kind of changed as well. And of course, the 90s was the tech boom. The 21st century now, technology is so different, and we know a lot more about the brains and the medical status and the learning capabilities mm-hmm. and the plasticity of the brain. We know a lot more now than we did when you were working just one of those transition decades. What can I say?
Yeah, well, I'm so happy to hear that, because I was in the early 90s, I believe 90 and 91. But it's great to hear that there's been so many shifts and changes. Now, I'm sure that with the society out there and with educators, there's still some myths around autism. What are they, if there are any prevailing still myths with society and educators?
Oh, you're putting me in hot water, Christina. I do not want to talk about the battle with the anti-vaxxers. I really don't want to get into it, but I'm going to just say this. I've been a practicing speech-language pathologist, an autism specialist. I've been consultant who's gone all over North America giving my Socially Speaking seminars since 2010. Mm-hmm. And the most pervasive myth that I've come across still, this new millennium, is that autism, number one, comes because of vaccinations. Mm-hmm. And number two, that autism can be cured with the right diet and possibly medication. Mm-hmm. And I'm here to say that I think that diet is something we should look at. I think that diet plays a role in the attention span, the irritability, the learning capability, the child readiness to learn. And I do believe that there are children who had a predisposition to autistic behaviors. Mm-hmm. And if they had other things going on at the time that they were getting the vaccination, they may have had a reaction, and it's a case-by-case basis, and I really don't want to get into this, but say as a blanket statement that vaccinations cause autism, and to say as a blanket statement that autism can be cured, are basically two myths that I think we really, really need to get rid of, especially today when we know so much more about the neuroscience of the brain, and we understand so much better neurotypical brain patterns versus brain patterns of children with autism. So those are the two pervasive myths that, depending where you go in the United States, let alone Europe and Asia and developing countries in Africa and India, it's still amazing to me when people say to me, autism can go away when the child is older. I kind of don't understand that.
Well, it's interesting, Penina, because I think it's not simple with anything going on neurologically or within illness in the body. I don't think anything's ever one thing. Like people say, oh, if you just change your diet, all cancer will be eliminated if you eat a good diet. I don't think that's necessarily true either. I think there's a lot of components that go into your body not operating efficiently or things going not quite right. Now, with autism, here's an interesting thing. I recall, and we had mentioned this prior in our pre-interview, that there are some people who exhibit autism-like traits, but don't neurologically have what's going on with their taking in information. And you go more deeper into how people process information who have autism, but they don't necessarily have autism. Explain for our audience a little bit about the differentiation between that.
Well, I would start by saying that one of the main traits that we look at when we're trying to figure out if a child has autism is how is their social behavior. We know already that it is easy to see red flags with regard to social behavior as early as 12 months, 18 months, for sure by age 2. So if we have children who are not talking by the time that they're 2, 3 years old, I'm not going to immediately say, we have to worry about autism. But if we have a child who's nonverbal and doesn't make eye contact and prefers to play with toys in a repetitive, fixated manner and gets very kind of lost in his or her own world, these are some of the red flags that concern me. And again, I think that the differentiating factor between autism and other special needs and intellectual challenges out there is the social communication, the social behavior piece. And that's one of the reasons why I created my Socially Speaking social skills curriculum, which has an assessment protocol, a test, as part of that curriculum, because I feel that there's a lot of misinformation and I feel that there's a lot of jargon in special education that unfortunately we professionals have to put in the reports because of documentation purposes, but then it creates a barrier between parents and professionals working together, including professionals outside of the school system who could help us with the child's overall health, like nutritionists and doctors and nurses and neurologists and neuropsychologists. So I turned my Socially Speaking assessment protocol into the Socially Speaking iPad app in 2012, where I created a checklist to show parents and professionals what are some of the red flags that if the child is exhibiting some of these warning signs, if the child is not doing some of these things with regard to social communication, which includes certain language skills, which includes certain play skills, it's important to then say, okay, I've got some red flags here. I'm now going to request a full battery evaluation where we're going to have different people test this child to see what's going on. So it's really important to stress again that I don't believe in the one-size-fits-all t-shirt, which, I can talk about later.
Yeah.
But I also don't feel that we have a one evaluation fits every scenario. I think that it's important to use standardized tests. It's important to use non-standardized tests. It's important to get a parent interview. It's important to observe the child and even videotape them in today's day and age because, again, what separates children with autism from other children who are having challenges is the way they are becoming disconnected socially from the environment around them. The key factor is that kids with autism get disconnected, they get disoriented from person, place, and time. And the severity of autism will determine how fast they can get back on track or how often or how severe is the disorientation to person, place, and time. So once I created that framework within my social skills curriculum, and once I started testing for that, all of a sudden it was much easier for parents and professionals to have an honest conversation and to honestly figure out what's going on with the child so that we can help them functionally instead of theoretically.
I love that. Now, for anyone out there who might be questioning, what exactly does that mean, being disconnected from person, place, and time? How does that look like? Because most people aren't having that difficulty. What does that mean exactly?
Sure. Actually, there are a lot of people, unfortunately, who get disoriented to person, place, and time. It usually happens in older people when they get dementia, if they have Alzheimer's. The truth is, when we have jet lag, if we've gone on a plane ride where we cross time zones, we get disconnected. We get disoriented a little bit to time. I remember being in, and I tell this story in my upcoming book. I'm putting out my social skills curriculum in book form. It's coming out in the next few weeks. I remember being in California and it was 9 o'clock there, but for me it was midnight. And we were all at a restaurant and everybody was ordering and chatting and my body's telling me it's midnight. You're not eating anything. So when a person is disoriented to time, it's kind of like that feeling when the clock changed a few weeks ago. And some people may have posted on Facebook that they're having headaches or they're feeling dizzy. A lot of our kids with autism are neurologically hardwired differently. So imagine them walking around like they're jet lagged much more often than you or me. And now kids with autism in particular can be disoriented to person and place, meaning that they have difficulty connecting emotionally or even paying attention to the people in their environment and what those people are saying. And it could be because the child is very internally distracted. There's a lot going on inside him or her. He may not be feeling well. He may not be feeling what we in special education call, grounded. There may be some sensory issues. The environment may be overstimulating. There may be too much loud noise or bright lights, or the child is just not understanding what that person is saying because the person is speaking too fast or the person is unfamiliar, provoking anxiety. So a lot of our kids who are disoriented to person, unfortunately, if we teach them to pay attention to their family or to pay attention to their teacher, well, what happens when they go to summer camp? What happens when they come back to school and there's a new teacher or a substitute teacher? And kids who are disoriented to place because they're internally distracted because they have sensory processing issues, where it's, I don't know how to explain this. It's kind of like they feel like there are ants crawling all over them while they're trying to sit and pay attention to you. Well, how can we expect them to perform if they're just not grounded and they're not living in the moment, they're not paying attention? And here's where the real social communication and behavior problems come, because if you're not really clued into the person who's talking to you and you're not really tuning into your environment, whatever lesson, whatever toy, whatever vocabulary, whatever stimuli you were exposed to at that moment in time doesn't go into your memory banks. It doesn't go into your processing system. It never gets on the highway because it just stays on the outside because you were disoriented and you weren't connected. And that's why I'm a big believer in early intervention, early diagnostics, early assessment, and of course, early treatment, because I want to get the child on the road to being connected to the people in their environment, to the objects and the rules and the pictures and the sounds and different things they come across in their environment. And of course, it starts them on the road to internally understanding time. Because kids who do not become oriented to person and place are not going to get to the third toll booth on the highway, which is time. It's going to be very hard. And in fact, the greatest challenge for kids with autism is having disorientation to time.
And I had heard it, remember the movie Rain Man? He was very, very connected to things having to be at a certain time and doing things a certain way. Is that the reason why? So they could keep a certain congruency with time? Right.
Well, I have to say, we have to take all those movies from Hollywood.
They're not perfect.
Of salt that I can't say children with autism act like the Rain Man guy. With the exception of Claire Danes and playing Temple Grandin, which was authentic in my professional opinion. A lot of the other movies, in my opinion, are not as authentic. However, you did hit upon something absolutely true. A lot of our kids with autism can learn through repetitive learning and, of course, through visual supports, pictures and symbols and reminders, kind of like being in an airport and knowing where the ladies' room is because there's a picture of, a woman in a dress on the door. So they'll learn to be oriented to person and place if we do the standard traditional special education regimen that we've been doing for decades. However, until 2004, when the behavior plan became part of an IEP, became part of a mandatory document called the Individualized Education Plan, the IEP, that every child who is in special education or gets special education services in America needs to have, we didn't understand that a lot of these kids don't respond to crisis intervention, and they have difficulty feeling neurologically that time is passing. So they're going to have a difficulty when their schedule changes. They're going to have difficulty transitioning to unfamiliar places. That's why the guy in the movie Rain Man got really talkative, repeating all sorts of things like the phone numbers from the phone book he memorized, because he was trying to figure out when is he supposed to be doing what. So it's really anxiety provoking to walk around feeling like you have jet lag all the time.
Yeah.
And that's why having a plan of action to explain to the child before what's coming next, either visually or having practice going to the doctor. I do this all the time. I actually try to find ways to have my child be prepared, my student with autism to be prepared for a dental visit before they're actually sitting in that chair and having a meltdown because it's the first time they've ever been in that room, let alone in the dentist chair, let alone who is this person looming over me, wearing a mask.
Yeah.
So important to understand that just repeating the directions to the child orally, verbally, just telling the child, we're going to do this at 3:00 or tomorrow you're going to the dentist, it's not enough because it doesn't stick. These kids who are disoriented to time need to see it visually. They need to see, and of course, if the kid doesn't understand numbers and doesn't understand how to tell time to begin with, saying that we're going to grandma's house at 5:00 is kind of meaningless.
Yeah. And you had mentioned earlier in our conversation how the one size does not fit all, and you don't believe in that approach. What exactly do you mean by that?
For many, many, many years, we were lumping together, and I'm saying this was way before the 90s. We were lumping together children with autism together with children with visual impairment, children who were deaf, children with special needs. And we kind of said that, okay, everybody kind of learns tactily, kind of learns kinesthetically. They learn by touching things, because in neurotypical babies, why do babies mouth things? Why do they put things in their mouth, when they're first learning about their world? Because we are hardwired to be tactile learners, to learn about our world by touching things. However, in the late 90s, and especially now, we have a lot of research showing that the opposite is true for children with autism. Many children with autism, and again, I'm not saying this is a blanket statement about every child with autism, but many children with autism are visual learners. The way they process information is visual. The way they remember information is visual. The one who said it best is actually Dr. Temple Grandin, who herself has autism. Although she has high-functioning autism, she's not a typical person with autism. She has a PhD. She's very articulate. But she has a great quote that I've heard her say, "My mind is like Google Images." You want to open up, my brain and see my filing system? It's like Google Images. And I think that that's something for us to remember, that children with autism are visual learners. However, if they have difficulty with other areas, if they are predisposed because of their level of maturity to be a tactile learner, then it's going to be more natural for them to be tactile learners. You see, the truth is everybody, no matter who they are, ends up in 3 categories. We are either auditory learners, visual learners, or tactile learners. And if you all think about it, listeners, you'll remember what you did when you were in school, or what you do when you're in school now to help you remember things. So the one-size-fits-all T-shirt program, which was that we were going to teach special education all in this manner, in one way. We're all going to have the same kind of lesson plan. We're all going to work on the same thing with the same toy or the same, arts and crafts project at the same time. It kind of doesn't work, because we have to take into account, number one, the child's learning style. Number two, the fact that if the child is autistic, there's a good chance that the learning style is visual. Not a blanket statement, but there is a good chance. And number three, we also have to take into account that people are people. People have preferences.
Mm-hmm.
I'm personally, not a really big fan of rice. I love Chinese food. Don't do the rice. Never did.
Mm-hmm.
So everybody has learning preferences.
Mm-hmm.
And if I have a child with autism who's really, really, really drawn to the iPad, I can understand if I'm going to put pens or pencils in the kid's hand and say, okay, we're going to write on a piece of paper first, and the kid's going, yeah, okay, that's tactile. I want visual. Now, I'm not going to say I'm not going to give that kid a pen or a pencil and work on the writing activity, but you can bet that I'm going to make sure that in addition to writing on paper, I'm also going to find ways to honor the child's inner landscape, to honor the child's learning preference, which is visual, and honor the child's personal preference and love for technology, and say, hey, when you finish this on the paper, I'll give you the iPad and we can play, this game and finish up with the iPad. So again, the one-size-fits-all T-shirt approach is actually in another few decades, in my opinion, is going to be obsolete for the most part in special education because, number one, we have something called the Behavior Intervention Plan as part of every single IEP, which is a federally mandated document from the government where we have to put in a whole system, so to speak, of how are we going to get children to behave. And obviously, we're going to have to take their preferences into account. But number two, with technology becoming so advanced, and we have mobile technology now, and everybody has smartphones and tablets, at their fingertips, think about how all of us customize our smartphone to make it look and act the way we want it to. Why can't we do the same in special education?
Makes sense. And that brings me to thinking, though, actually, it would be a great process to bring to all of education, because I think we spoke prior in our pre-interview that I have dyslexia, and it was quite extreme in my childhood years. And people can understand why at ninth grade I was reading Dick and Jane and could barely write. And it wasn't because I was an idiot. They actually classified me as partially retarded. And it was very sad. It wasn't until I came to New York and they hooked me up with a tutor that they realized, okay, you have dyslexia and there's a way to work with it. And my saving grace was actually Word and working with the computer, because I was able to have the computer correct things I mixed up better and had my thoughts make more sense on paper when I did them on the computer, hence to doing them with my hand with a pen and paper.
Absolutely. And that's honestly why I am such a big proponent of integrating toys and technology in treatment. And the name of my book, which is based on my Socially Speaking program, is Autism in the iEra, Practical Social Communication Strategies for Integrating Toys and Tech in Treatment. I'm obviously an iPad evangelist. The truth is, while I was finishing up my master's at NYU in New York to become a speech therapist, I already had teaching experience as a special education teacher under my belt, and Apple was looking for people like me. Apple teamed up with Westchester Institute of Human Development in New York State, and this was 1995, to find people like me who liked technology, understood what it could do for special education, and wasn't afraid of it. Remember, in 1995, there were many of us who didn't really know what technology is and what it could do. And I was one of the first, I guess you could say, Mac evangelists in special education who got trained and then trained many other people in special education, teachers, therapists, how to use technology. Now, of course, in the 90s, technology meant software. How to use technology to kind of deviate from the script and not buy into the one-size-fits-all T-shirt approach. And then, of course, when the iPhone came out, and then, of course, when the iPad came out, I became known as, iPad evangelist. And I went around the country giving specialized seminars to people on, the developmental approach. And I created a developmental framework for integrating iPad apps into autism intervention. And that's all, going to be in my book, because there are so many kids out there with your story, Christina, kids with autism, kids who are in regular education classrooms, kids with autism who are in regular education classrooms, who we cannot always tap into their potential because we don't always understand what's going on with their inner landscape. But if you put technology in their hands and they can customize it, and if you can put technology in their hands and all of a sudden they have a tool to communicate, but more importantly, they have a tool to compensate for some of their difficulties, all of a sudden the door opens, the light shines in, and we've got a completely different kind of set of expectations for these kids. And I'm thrilled to hear how Microsoft Word helped you. I understand, and I've seen it, and I actually have used it, with some of my older students. I of course specialize, in Apple technology, but more importantly, I happen to specialize in early childhood intervention. So I've worked with much younger children on the autism spectrum, and I cannot stress enough how important it is to find that one person, like that tutor who suddenly looked at you and said, hey, wait a second, we're going about this the wrong way. Let's try this.
Absolutely. It saved my butt. Having that tutor and having access to a computer was a lifesaver for me. So before we head on out here, there might be some parents or people listening in who need your services, need to find out more about your upcoming book and help with their child or someone in their family. How can they reach out to you, find out about getting your book?
Thanks so much. First of all, I would tell everybody that if you want to know more about the Socially Speaking program, you can find me on YouTube, Penina Rybak, PENINA My website is sociallyspeakingllc.com. I also have a Facebook page by that name, sociallyspeakingllc.com. And I'm on Google+. And of course, I'm on LinkedIn and Twitter. My book is going to be self-published. I had a lot of graphics and charts I created, and I put a lot of links to very helpful websites, and it made the traditional publishers nervous, and decided in the end that I wanted the book to come out as a real guidebook for the iEra, and I wanted it to be a reflection of how practical and easy to implement my Socially Speaking program is. So again, I decided to self-publish my book, and I'm publishing it through Author House, and it's going to be available, I hope by mid-April, the end of April. I understand that April is Autism Awareness Month, but in the meantime, I would tell everybody to keep checking my website, sociallyspeakingllc.com. Keep checking my Facebook page, Socially Speaking LLC. You could also find me on Pinterest. Again, Penina Rybak, PENINA And of course, you can connect with me on LinkedIn, and you can then find my email address and be in touch with me. I give seminars around the country and Canada. I am going to be speaking in Florida in May. I will actually be speaking, Christina, at the YAI Autism Conference in May. At the beginning of May, and I'll be speaking at the FLASHA, the Florida Speech Therapy Convention, at the end of May, and I will be speaking at Mobile Education, or Mobile Learning Experience, which is all for educational technology professionals, not necessarily an autism intervention, but anyone who works with EdTech would probably want to know about Mobile Learning Experience 2015, which is happening in Tucson, Arizona from June 10th to 12th this year. But I do list on my website and on LinkedIn and on Facebook and on Pinterest, where I am and what I'm up to. You can learn more about my Socially Speaking program and how parents and professionals can work together to really help children learn better, perform better, and socialize better and behave better based on my 22 years in the trenches working, in a variety of ways with kids with autism, integrating toys and tech in treatment.
Wow. Well, Penina, it's been so insightful and wonderful having you share your knowledge and wisdom today. Thank you so much for sharing this with our audience, and thank you for coming to Savvy Central Radio.
Thanks so much, Christina. Have a great day.
Savvy Central Radio is proud to present a live interactive series featuring a new mix to business networking and interviews. Our first event will take place Saturday, April 18th from 12 noon to 3 p.m. You'll not want to miss our first guest, Bryn Johnson. Our interview question portion of the event will be concluded by a business networking gathering of light fare and cocktails, where you'll be able to meet new and exciting like-minded business owners like yourself. To find out more, book your free ticket today at bit.ly/savvy event. That's bit.ly/savvy event.
you.